Okay, so now we are going to start with superficial mycosis. And in superficial mycosis, first we are going to start with tinea versicolor, also known as pityriasis versicolor. So, what tinea versicolor is actually, it is a chronic recurrent infection, which is caused by the chronic recurrent infection, which is caused by, I will be using C slash B for caused by, okay, which is caused by a lipophilic fungus, Malassezia furfur. Okay, so it is a lipid-loving fungus, Malassezia furfur, and this disease involves superficial layer of your skin. Superficial layer of your skin, that is your stratum corneum. Okay. So when a patient of tinea versicolor comes to you, how are you going to determine whether it is tinea versicolor or something else? So this tinea versicolor is characterized by some features. Okay. First, these lesions that you're going to see are going to be flat, not fat. They're going to be flat, round, scaly lesions. Okay, which are non-inflammatory and non-pruritic. Okay, this word scaly is important, guys. Why is it important? Because these similar lesions are found in case of vitiligo, where the lesions are obviously flat and round, but they are non-scaly. So let's write it here. In vitiligo, lesions are non-scaly. Okay, so where exactly are you going to find these lesions? By the way, these lesions have a favorite site. Okay, all the areas in your body which are rich in sebaceous gland, as it is a lipid loving fungus, so that is very understandable. So areas rich in sebaceous gland, such as your neck, your abdomen, and your back or upper arms. Okay, so mostly lesions are going to be seen here. Now that you think clinically that it could be tinea versicolor, how are you going to actually confirm your diagnosis? So for that, we have these various live diagnostic methods. So first, obviously, you are going to obviously want to do a KOH mount, right? As it is a skin disease, so you will have a specimen of your patient as skin scrapings. Okay, then you are going to perform a KOH mount on these skin scrapings, and you are going to use obviously the 10% KOH concentration that we talked about. If it would be nails, so you would use 20 to 40% concentration. So 10% KOH concentration will be used. Then you are going to see under the microscope, and what you are actually going to see, it will look like something like this. Yeast-like fungi along with small, short hyphae. Okay, curved hyphae. These are small enough. Okay, so pardon my drawing, but I am going to show you a picture of this. So these are short, curved hyphae, and this is yeast-like fungi. So this particular appearance has a name. Okay, this is known as spaghetti. Okay, this is known as spaghetti and meatball appearance. Okay, so this is what you are going to see under the microscope. Now what else you can do? You have done the KOH mount and then you have examined it under the microscope. Secondly, you can do culture, right? So how are you going to do the culture? I have told many times that the most common culture medium for the fungus is SDS, Saprotextros agar. But as it is a lipophilic fungus, we are going to give it what it loves, right? We are going to give it lipid. That is, we are going to overlay this SDA culture with olive oil. Okay, and this SDA overlaid with olive oil is the ideal culture for Malassezia furfur. Now after you culture, so what you are going to see? You are going to see fried egg colonies, which by the way are going to appear after 5 to 7 days. Okay, when you incubate it at a temperature of 32 to 35 degrees Celsius. Okay, so now you have done the culture also. What else you can do? This fungus Malassezia furfur is urease positive, so you can do a urease test as well. Okay, it is going to be positive. And lastly, what else? These skin lesions that I was talking about, which you can see here, okay, hypopigmented, scaly, round flat lesions, okay, they appear under wood's lamp. Under wood's lamp, they are going to give a golden yellow fluorescence. Okay, so this is how you can diagnose it. See, I'm going to zoom in. Okay, this was the spaghetti meatball appearance I was talking about. See here, the yeast-like fungi, right? A lot of these small circles that I am highlighting. Okay, these are all yeast-like fungi. Plus there is the short hyphae, short curved hyphae. Okay, so this is what microbiologists are calling spaghetti and meatball, not the real spaghetti and meatball. Okay, and this is the fried egg colonies on SDO overlaid with olive oil. I haven't personally seen them on under the microscope because I am a COVID kid, but this is how it appears, at least what I could find on the internet. Alright, so these are the fried egg colonies, and these are the spaghetti meatball appearance, and this is the scaly lesions, hypopigmented ones. Okay, now that you are sure that of course it is a tinea versicolor case, now what are you going to give your patient to treat it? Okay, so in the treatment of tinea versicolor, we give selenium sulfide shampoo. Okay, we basically give topical things, okay, like shampoo and creams. So selenium sulfide shampoo. You can also give ketoconazole shampoo or cream. Okay, and you can give terbinafine cream. You can remember this terbinafine as tere bina fine, like what you tell your ex. Okay, I saw it in a meme, so I thought I'd share. Okay, so we are done with tinea versicolor now. Now let's see Piedra. Piedra is another infection, fungal infection. It is basically infection of your skin, your hair. Okay, it is infection of hair. Now, as I've written already, black Piedra is caused by Piedra horti, and white Piedra is caused by Trichosporum bengli. Now, what happens in black Piedra is that you are going to see black colored nodules, okay, black colored nodules which are firmly attached, okay, firmly attached to the hair shaft. Where in case of white Piedra, you are going to observe white, okay, whitish soft nodules, okay, whitish soft nodules which are not so firmly attached. We can say they are loosely attached to the hair shaft. Now that you know that, okay, in black Piedra we can see this, and white Piedra we can see this. This is the presentation. So how are you going to, actually examine it, like on the culture? So on the culture, what you are going to see in case of black Piedra, okay, we are going to see on culture the reddish brown colonies, okay, reddish brown colonies which have dark brown hyphae, which are septate, by the way. Okay, being septate means it could be any other class but zygomycetes, because as I told, zygomycetes have aseptate hyphae, so remember that. So on culture, in case of black Piedra, you are going to see reddish brown colonies which are having dark brown hyphae, which are septate, and also they have this ascus containing ascospores. Okay, now what is ascus and what is ascospores? Let's see. Let's just ascus is nothing, it's just a bag which is containing a lot of candy, where this bag, ascus is the bag and the candy is ascospores. This is the kind of candy I would recommend you not to eat. Okay, so now in case of that is about black Piedra, but in case of white Piedra, you are going to see whitish creamy colonies, okay, which is understandable, it is white Piedra. Okay, you are going to see creamy white colony or whitish creamy colonies which are they have hyaline septate hyphae, okay, again septate hyphae. And these septate hyphae also have arthrospores. And remember, arthrospores are not sexual spores. Anything that I told you, all the sexual spores I have told you already: zygospores, oospores, ascospores, basilospores. Except that there are no sexual spores that we have to remember. Whatever spores I will talk about, they will be asexual spores. Okay, so this is what you are going to see in after under the microscope of after the culture. So let's see in here. This is a hair with black Piedra. Okay, this is the hair shaft, and you can see this is the nodule, right? And here you can see this is the hair, and you are seeing these white nodules. This is the case of white Piedra. Now we are done with Piedra also. Let's talk about tinea nigra. This tinea nigra is caused by Horty Wernicke, right? And this disease is characterized by painless, black, non-scaly lesions. Okay, in case of tinea versicolor, the lesions were scaly lesions. These are non-scaly lesions. Okay, and they are mostly present on hyperkeratotic skin. Hyperkeratotic skin like your palms and your soles. And this lesion is mostly common in females as compared to males. Okay, so that is about tinea nigra. So let us recapitulate what we have learned so far. Okay, so first we saw about tinea versicolor, and we saw that it is a chronic recurrent infection which is caused by a lipophilic fungus, right? A lipophilic fungus which is known as Malassezia furfur. Then we saw the clinical features of tinea versicolor, right? That they have these flat, these round, scaly lesions. They are non-inflammatory, they are non-pruritic, and these lesions that we see in tinea versicolor can be mistaken for vitiligo. But we have to remember that in vitiligo, the lesions are non-scaly. Okay, and where are you going to find these lesions? These lesions are going to be present in areas which are rich in sebaceous glands, such as your neck, your abdomen, your back, your upper arms. Okay, now that you know that maybe you are suspecting that it is a case of tinea versicolor, so you are going to confirm your diagnosis through the various diagnostic methods, right? You are going to do a KOH mount. Okay, and on your KOH mount you will obviously use the skin scraping taken from the patient as a specimen, and 10% KOH concentration you are going to use, and then you are going to use the microscope to see the appearance, which is going to look like these: a spaghetti meatball appearance. Okay, you are going to see these yeast like fungi along with the short curved hyphae. Okay, and then you can do, of course, your culture on SDA. But as it is a lipophilic fungus, we overlaid the SDA with olive oil, which is basically the ideal culture for Malassezia furfur. Now so you culture this fungus, and you are going to see the fried egg colonies. Okay, you are going to see fried egg colonies, which will appear about 5 to 7 days later if you incubate it at 30 to 35 degree Celsius. Now, what else you can do? You can do a urease test, which is obviously going to be positive because it is a urease producing fungus. And the scaly lesions that we talked about are going to appear under the Woods lamp as they are going to give a golden yellow fluorescence. Okay, these the lesions we talked about, and obviously the spaghetti meatball appearance that we already saw, and the fried egg colonies. Now, how are you going to treat your patient? You are going to give him or her selenium or sulfide shampoo, or the ketoconazole shampoo, or the terbinafine cream. Okay, you can give all these for about 2 weeks. Okay, remember this. Then we saw about Piedra, which is nothing but the infection of your hair, and there could be 2 types of Piedra based on the types of nodule you are going to see, and these both are caused by different kinds of fungus. So black Piedra is caused by Piedra horti, and white Piedra is caused by Trichosporon begli. In black Piedra, you are going to see black nodules which are firmly attached to the hair shaft, and in Trichosporon, you are going to see whitish soft nodules which will be loosely attached to the hair shaft. And when you culture this Piedra horti, they will form reddish brown colonies, and they will have dark brown hyphae. See, because they are producing this dark brown hyphae, Piedra horti is an example of pheoid fungus. Pheoid is basically means pheo means dark, so hence it is an example of pheoid fungus also. Then they are going to have dark brown hyphae along with ascus containing the ascospores. Okay, and in case of white Piedra, they are going to form whitish creamy colonies with hyaline septate. Okay, so hyaline septates hyphae, and they will be having arthrospores, which is a kind of asexual spores. Okay, so we saw the nodules. Okay, this is the nodule in case of black Piedra, and these are the nodules in case of white Piedra. And then we talked about tinea nigra, which is caused by this fungus Horty Warnecki, and it is characterized by painless black non-scaly lesions, which is literally opposite, because literally opposite of tinea versicolor. Not exactly, but you can see this. You can see the differences. They were hypopigmented. These are black. They were scaly lesions. These are non-scaly lesions, and these are present on hyperkeratotic skins or the areas such as your palms and soles. And this infection is more common in females as compared to males. In the next video, we will talk about dermatophytes. Okay, dermatophytosis, which is caused by dermatophytes.